Hi, I'm Elisha Khawas. Today I'm here to present the case study about renal calculi. Renal calculi is also known as kidney stone, which is the solid mass made of crystals which are found from the salts in the urine. It is one of the most painful medical conditions which can block the flow of the urine, kidney failure, and infection. It can be brown or yellow, rough or smooth. Kidney stone can vary in location and size. The leading cause of kidney stones is a lack of water in the body. Stones are more commonly found in individuals who drink less than the recommended 8 to 10 glasses of water a day. When there is not enough water to dilute the uric acid, a component of urine becomes more acidic. Low fibrous diet and unhealthy eating habits can also cause kidney stone. Medical conditions such as Crohn's disease, urinary tract infections can also cause kidney stone. There are mainly four types of stones, which are calcium stones. Calcium stone is the most common type of stone. They are often made of calcium oxalate. Eating less oxalate-rich foods can reduce the risk of developing this type of stone. High oxalate foods such as potato chips, chocolate, spinach, peanuts, etc. Uric acid stone. This stone develops when urine is too acidic. Diet which are rich in prunes can increase the urine's acidic level. They can occur in people with gout or those going through chemotherapy. This type of stone is more common in men than in women. Struvite stone. This type of stone is found mostly in women with urinary tract infections. These stones can be large and cause urinary obstruction. They result from a kidney infection. Treating an underlying infection can prevent the development of struvite stones. Cystine stone. This is the least common type of stone. They occur in both men and women who have the genetic disorder of cystinuria. With this type of stone, cystine, an acid that occurs naturally in the body, leaks from the stones in the urine. Now I am going to present a case study about kidney stones. A 46 years old female name is Mary presented in emergency department with medical services having severe pain in right flank, nausea, vomiting and fever in last 3 days. She assumed that she might get pain due to another stone in her kidney. She has also complained of burning micturition and pain in her right flank worsened and felt weak and light headache. She is divorced, sleeps alone by herself, eats in cafes and restaurants mostly with friends. She is bookkeeper by profession. According to the marriage, she has previous history of nephrolithiasis which was treated, but there is no any evidence available for her treatment. A baseline observation was made for Mary where the vital signs was monitored. The blood pressure was 127 by 82 mm of Hg, pulse rate was 78 beats per minute, respiratory rate was 23 beats per minute, temperature was 36.2 degrees Celsius, oxygen saturation was 97% and room air. Tachypnea has seen due to the severe pain she was complaining during the admission. During the physical examination, patient also complained about the pain in her left lower quadrant and there was a tenderness in the muscle. Pathophysiology of Mary. Kidney stones formation is common. In the context of Mary, she has a past medical history of nephrolithiasis, where she is more likely to have kidney stone. By monitoring the signs and symptoms of Mary, there was a clear indication of having kidney stone. Kidney stones development is thought to require the formation of crystals in the tubular fluid, followed by crystal retention and accumulation in the kidney. The substances such as calcium oxalate and uric acid in the fluid in the urine can dilute. At the same time, the urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones. In low urine volume, the presence of high calcium, high oxalate, the supersaturation of calcium oxalate is increased. Citrate in the urine forms soluble complex with urinary calcium. If urine has low concentration, is prompted to form calcium oxalate stone. The adequate amount of food that are rich in magnesium and citrate can cause the arrangement for calcium oxalate and calcium phosphate stone. There are many risk factors for the condition of Mary. The first one is dehydration. Not drinking enough water each day can increase the risk of kidney stones. She is a bookkeeper by profession, so due to the increasement in physical tasks, Mary who sweat a lot to be at higher risk than the other people. Diet with high level of salt, protein and glucose. Eating a diet that is high in protein, sodium and sugar may increase the risk of some types of kidney stones. This is especially true with a high sodium diet. Too much salt in the diet increases the amount of calcium in kidneys, significantly increases the risk of kidney stones. Mary has a past medical history of nephrolithiasis. Diseases and conditions that may increase the risk of kidney stones include renal tubular acidosis, cystinuria, hyperparathyroidism, certain medication, and some urinary tract infection. The living style of Mary can increase the risk of kidney stone. Less exercises and unhealthy eating habits can increase the chance of having kidney stone. The diagnosis that was made for Mary are blood tests. Blood test was done where calcium, phosphorus, uric acid electrolytes was checked. Blood test helped to monitor the health of the Mary's kidney status. Renal function test was done where uric acid and calcium level was higher than the normal range. CT scan and abdominal X-ray was performed, revealing the 5.5 mm of the kidney stone. And also blood urine nitrogen was checked to assess the kidney functioning, which was normal. Now I am going to describe about the nursing care plan for Mary. The first nursing diagnosis for Mary is severe pain in the right side of the back. The intervention for the severe pain in the right side of the back is to monitor the characteristics and location of the pain at the beginning. After monitoring the characteristics and location of the pain, I have administered the medication which is non-steroid anti-inflammatory drugs, which can be ibuprofen, and also assisted the Mary to put in the comfortable position. I have also assisted the Mary for the emulation of the pain relief. The overall evaluation of the nursing diagnosis and intervention is patient reported that the pain is relieved after 8 hours. The next nursing diagnosis for Mary is SS for dehydration. The intervention for dehydration are encourage the patient to drink 3 to 4 liters of fluid per day. Initiate IV fluids if the fluids are necessary. Monitor for the output and input of fluids. The overall evaluation for nursing diagnosis and intervention are hydration promotes the passing of urine easily. Maintaining maximum hydration level will help the movement of the stone and prevent further complications. The third nursing diagnosis for Mary is to monitor the signs and symptoms of infection. The nursing intervention for the signs and symptoms of infection are due to the less intake of fluid, patient might have the chance of infection. So in this case, I need to encourage Mary to drink enough fluids, administered antibiotics if necessary. The overall evaluation for nursing diagnosis and intervention of Mary is to check the urine color and odor. The treatment plan for Mary are maintenance of the lifestyle like controlling of the diet. Limiting of sodium and animal protein in the diet may reduce the chance of kidney stone to form. Also encourage the Mary to have high fibrous diet like fresh vegetables and fruits. Regular exercise is very important, so it can help in the movement of the stone and to pass easily. Maintenance of the hydration level. Mary needs to drink 3 to 4 liters, which can help in the movement of the stone and maintain the hydration level. It can also reduce the chances of urinary tract infection. Medication for the management of the pain is necessary, and non-steroid anti-inflammatory drugs will help to control the severe pain in the patient. Pain medication helps in the relaxation of muscles, which assists the stones to pass through. After 6 to 8 weeks of treatment, the stone passed spontaneously. The final doctor appointment was made and CT scan was done for the clearance result of kidney stone. If the disease is not treated in time, the following possible complications can be seen. Kidney stones can block the urethra or make them narrow. It can also cause the injury to the urethra. If the kidney stone is not treated in time, this can increase the risk of infection like UTI. There is also high chance of kidney failure. Patient may also experience the severe pain due to kidney stone. The kidney stone can be occur again and again if it's not treated in time. Patient might experience obstruction or blockage in the urinary tract. Patient might get sepsis, which can occur after the treatment of a large kidney stone. Once the patient is discharged from the hospital, patient education is very important. I will ask Mary to participate in the activities like doing regular physical exercises. I will also ask the patient to drink enough fluids like 3 to 4 liters per day. I'll also ask the patient to eat healthy and fibrous rich food, regular checkup if she experiences any discomfort.